This video is intended to acquaint you with the proper and safe use of the Span America Custom Care Convertible Low Air Loss System. This system is defined as a therapy surface which automatically adjusts a network of interconnected air cylinders and elasticized reservoirs to the appropriate level of support regardless of the weight or position of the patient. The maximum weight limit on this system is 500 pounds. This system can be used with or without the controller in place. It has a mattress component and a controller component. The controller provides airflow to the support surface and to several therapeutic modes of operation. It's important to let you know that all the systems obtained by Southern Illinois Healthcare will have a controller with them. It's dedicated to the mattress. This is of great benefit to your patients presenting with various levels of risk for soft tissue injury. The system addresses the 5 major environmental contributors to soft tissue injury, those being pressure, shear, friction, moisture, and heat. The surface itself protects against friction and shear in that it's a very forgiving surface when you move on it. Pressure is managed by the ability of the surface to immerse the patient into the surface. And moisture and heat are addressed by airflow through the system, which evaporates moisture and dissipates heat, both of which have been demonstrated to be contributing factors to soft tissue injury. So that's taken care of for you. The controller itself, on the left-hand side as you face it, is connected to the mattress by a series of tubing. And this tubing protrudes from the mattress on the patient's right-hand side at the foot of the bed. These sets of tubing should not be separated. The system will always be equipped with a controller. If there's a need to separate the tubing, it's best done when they are connected to the mattress, because if you remove the tubing from the controller, it can result in its being misplaced or lost. So the system, again, is designed to operate in 2 ways. As a non-powered system when the controller is not on, or as a powered system when you activate the controller. Let's talk about connecting the control unit. It is designed to hang on the foot of the bed with hangers behind it here, and it also has an air filter with vents on the back of this controller. You should not obstruct those in any way with linen, so be wary of that and make sure that that doesn't happen, because it could damage the controller. Also, the power cord comes out from the side, the left side at the bottom of the controller, just below the power switch. You want to make sure that your cord is resting freely on the floor for safety. There is a large tubing set that also plugs into this left side of the controller, and that is what provides the dedicated airflow to the mattress cover itself, which manages heat accumulation and moisture dissipation. So you want to make sure that that's connected and check that. The first thing you want to do is turn the unit on, and that's with the power switch located here at the lower left-hand side of the controller. You're looking at the controller now. You can see the lights come on the control panel. They all come on for a few moments and then go out. The system automatically defaults to what's called the float mode. There are 3 modes of operation here: alternating, float, and rotation. So the first thing you want to do with the setup of the system is to choose the mode of therapy you wish to use. In the float mode, the system is uniform, the surface is uniform, it's not rotating or alternating, it's just a uniform pressure managing surface. If we push the button again, it goes up to alternating, and alternating pressure is provided on a cycle time of 15 minutes. Rotation, also a 15-minute cycle. One thing that's important is if you're in the rotation mode, make sure that the head of the bed is not elevated above 30 degrees. It can create some issues that we'll talk about later. There are additional settings on the controller that you need to be aware of also. The first is the comfort level, which is on the right-hand side. This is generally set by pushing these arrows, and you have a range from 1 to 5. 5 being firmer, 1 being softer. And generally on patients of 120 pounds or less, your initial setting is going to be 1. If you have larger patients, you can increase that to where you have good immersion of the patient. Actually, the less air you have delivered to the system, the more immersion you're going to get. But you also want to make sure that the patient is properly supported and they're comfortable. So this is your range. Anyone over 120 up to 500 pounds, you would use settings from 2 to 5. Okay? You also have a button here called Auto Firm. If I press that, it overrides everything else that's going on the mattress. It brings your comfort level up to 5, so it's moving more air through the system, and it firms the mattress so that it's a nice uniform firmness of the mattress. We have the light illuminating here letting us know that that's in the auto firm mode. This is a good mode to use if you are doing a lateral transfer or a seated transfer of the patient, or just repositioning the patient. It can be helpful. When it's engaged, the auto firm will stay on for a 30-minute period of time unless you manually disengage it. So when you engage it, 30 minutes on, disengage it, it's off. If you leave it in auto firm and fail to come back, it will automatically default and disengage, and the system will return to its previous setting. And that was a setting of 1 and rotation of 1, and I can demonstrate that again. Setting of 1, rotation, okay? Another feature is the lockout, and that's a safety feature. It basically assures that the settings are consistent and there's no accidental or unintentional change made to the settings. And I suggest that when you're making your rounds, you assure that your controller is locked out. That way, if our environmental services wipes this down, if a family comes in and is curious, none of your settings are going to be changed, and you should really check this and make sure this is right at least once a shift. If you come in the room and the lockout is turned off, then the settings could have been changed by someone. It's vulnerable in that mode. There is a low system pressure indicator that lights up initially when you turn the system on, and that's only on for a few seconds. And then it goes to normal pressure, as you can see here. If the low pressure indicator comes on at any time during normal operation and stays on, you need to bring this to the attention of environmental services. Okay? If you ever need to separate this controller from the mattress, and it's not apt to happen in Southern Illinois healthcare hospitals because you have one dedicated to the mattress, there is a process for doing that, and that is the disconnect weight resetting process. So if you're going to disconnect this mattress from the patient, or pardon me, the blower from the mattress, if you're going to disconnect the controller from the mattress, you need to press this button here, and now it's going into the disconnect mode, and it's telling you to wait, that it's resetting the system, and after a moment or two, this will go to a green light, which tells you that you can now disconnect the mattress. I'm going to reset that because I don't want to wait for that to happen. So I'm resetting the system, and that's your reset procedure. Finally, there's some general directions for use of this piece of equipment from a clinical perspective. As far as elevating the head of the bed goes, it should really never be more than 30 degrees. If it has to be more, that's fine, but operation efficiency of this system, and any system really that's powered by air, is most effective when the head of the bed is at 30 degrees or less. Side rails, follow your protocol. That's all I can say about that. Because it's different in different places and with different patients, the way they present, assessments, those sort of things. So follow your hospital protocol with respect to side rails. The CPR instructions are, as you can see, printed on the controller, and they're pretty self-explanatory. You set the system on float. Okay. Take your comfort level setting all the way up to 5 and get the patient on a crash board. I'm going to take that back down. As far as transporting this system, you unplug it from the wall, you can transport it. It will maintain air or support of the patient until you get back to wherever you're returning to and plug the system back in. A seated transfer, I would use the auto firm if you're going to do a seated transfer for the patient. Now, one thing that's important, if you have a power loss in the hospital for some reason and power is interrupted to this, whether it's unplugged or you actually have an actual power loss, this system, when power is returned to it, will resume the settings that were in the system prior to that happening. So you don't have to worry about resetting anything up. It's automatically going to go back to those settings. As far as linens go, the less is better. As far as underpadding goes, the less is better. I know they make a paper pad that's very thin. That might be a good choice in some of your patients. And from a complaints perspective, there's no perfect product. There are two issues that come up sometimes with powered systems. The first is when you're in the alternating mode. Patients typically are not accustomed to alternating pressure. The mattress at home doesn't move. They may feel this move underneath them and think there's something wrong with the mattress. I think a simple explanation generally overcomes any concern they may have about the mattress with respect to it moving. The other is when the system is in rotation. If the head of the bed is above 30 degrees, a lot of times patients will complain of being in a hole. And that does not change unless you get the head of bed down to 30 degrees or less. That sensation is normal at higher elevations of the head with the way the system is designed. It's still therapeutic, but it may be uncomfortable for the patient if the head of the bed in rotation is greater than 30 degrees. Finally, as far as cleaning the system goes, environmental services will be managing cleaning of the system between patients. If the surface is soiled while you're caring for someone, you can clean this system with soap and water, rinse it, and allow it to dry, and you should be fine. Thank you very much.